Is Uterine Cancer Awareness Month, a month dedicated to raising awareness about uterine cancer, its symptoms, its risk factors, and treatment options. Joining us now to discuss this and so much more is Dr. Monica Jones. Dr. Jones, good to see you and welcome to the Fox 5 Live Zone.
Good to see you too. Thanks for having me on.
Yes, ma'am. Let's talk about this because I want to reiterate this is so important, and I want to make sure we touch on this, and that's why we had you come on the show today. For folks that are still trying to wrap their heads around this, and I got to be honest with you, I was not really familiar. What exactly is the disease and how common is it?
No, well, endometrial cancer or cancer of the womb is the most common cancer affecting the reproductive tract of women. And tend to see almost 70,000 new cases each year and expected to see that this year. Unfortunately, it has surpassed ovarian cancer as being the most deadly female reproductive tract cancer. And so that's why it's so important to raise awareness, Guy.
Yeah, and speaking of awareness, we need to talk about some of the things that we should look out for. I'm referring to the warning signs that women should really take heed to once they start.
Yes, usually after women have stopped having periods, they really should not resume. It is not normal to resume periods after menopause, and that is the most common symptom that will occur with this cancer. Also, bleeding in between periods or very prolonged bleeding are also some of the warning signs that you definitely need to get checked out.
And so, with that being said, can you tell us about perhaps screening tests that one could actually utilize?
Fortunately, the best screening test is someone being in tune with their bodies and being in tune with what's normal as it relates to their menstrual cycle. As I said, anything that's out of the ordinary, bleeding in between cycles, or very prolonged bleeding are all warning signs that will trigger a biopsy or an evaluation of the lining of the uterus with imaging.
Let's talk about lifestyle changes. I bring that up because let's say we're talking about lung cancer, and we know that if you happen to smoke cigarettes or cigars or what have you, that could lead to lung cancer. Anything we should know about that perhaps one could change their lifestyle so that they could avoid something like this happening?
That's a great question, Guy. We tend to see these cancers in women that carry a little bit more weight than is healthy. We know that the more weight we carry as women, the more estrogen is circulating, and that is estrogen without progesterone, hormones made by the ovaries in a very balanced way, becomes imbalanced. And the more estrogen we see, the more likely you'll have trouble with a problem with endometrial cancer. So we tend to encourage people to stay within a healthy weight to decrease their risk of developing this cancer.
It is no secret you are part of the Society of Gynecologic Oncology. I'm curious, anything in particular that you all have coming up that we should be made aware of?
Thank you for asking that. I'm very excited about the national race to end women's cancer that is occurring in September, September 15th to be exact. I'm sorry, September 14th to be exact. And it really is an opportunity for those of us that have had family members and those of us that are really fighting this cancer to get together right in Washington, D.C. on the mall to raise awareness, to maybe raise funds, and to really support women that are affected by this cancer and to try to do what we can to prevent it in the future. So September 14th is the day we will be in Washington, D.C. for the Foundation for Women's Cancer Race to End Women's Cancers.
Dr. Jones, you just made mention of family members, and it's no secret, or perhaps it is for folks that aren't aware, but with regard to uterine cancer, it really happens to affect women that look like, well, both you and I, that happen to be African American. Can you elaborate on that?
Yes, we do know that African American women do have or do suffer higher rates of adverse outcomes related to this type of cancer. And we know that's true because some of the more aggressive forms of this cancer tend to affect African American women more commonly than non-Hispanic white women. Therefore, unfortunately, we do see higher rates of death.
Hmm.
And in fact, most women with these more rare forms present with more advanced stages, and that is why they tend to have worse survivals.
Dr. Jones, folks that would like more information, how would one go about to get that?
You can always use the Foundation for Women's Cancer as a resource. That is www.foundationforwomencancer.org to get more information. They have information for healthcare professionals as well as for lay individuals to learn more.
Good stuff. Yet again, we have been speaking with Dr. Monica Jones. Truly appreciate you, Dr. Jones. Thank you so much for coming on the Live Zone.
Thank you, Guy. Have a
You're
great
welcome.
day.
You too. All right, guys, we're going to take a quick break. Hey, keep in mind, yet again, we are awaiting a White House press briefing. Of course, White House Press Secretary Caroline Leavitt. That should get underway shortly after 1 p.m. And of course, we'll carry it for you right here on the Live Zone.